Hello again, everyone. I'm John Newstreet, Kissimmee, Osceola County Chamber of Commerce President and CEO. We're delighted to be with you here for another live webcast. Today focuses on a very somber and important topic related to our business, our employees, and life in general. So we're going to bring up our very special guest here to talk about suicide. Claudia Swonger is the Director of Behavioral Health and Community Outreach with Osceola Regional Medical Center. She's been a guest in the past, and this month is National Suicide Awareness Month. So we wanted to check on everybody, make sure we're checking on each other, helping each other through these tough times and staying strong and recognizing the importance all of us play in making our community better. And so Claudia's an expert in this topic. We're glad to have her as a guest. Good morning, Claudia.
Good morning, John. Thank you for having me.
Absolutely. So this is a lot to talk about. We have just the 15 minutes. So if you don't mind, we'll dive right in. And I know you have a PowerPoint we pulled up here. So it is Suicide Awareness and Prevention Month. And there's a lot of data that kind of goes along almost scary about the reality of suicide. And I know my life's been impacted by suicides. I'm sure many others. And so can you talk about the data and maybe compare what we saw pre-COVID, if you can, to what we're seeing through COVID as far as suicide?
Absolutely. So I think it's important to just quickly go over some of the terms so people can understand the proper terms. So we have the suicide ideation, which are the thoughts. And these could be just talking about wanting to die, feeling hopeless. Hey, what if I wasn't alive? What would happen? So, and then we have the actual suicide attempt, which is people have done it in various ways. It could be overdosing, gunshots, hanging, non-fatals though. These are the attempts, but not fully going through with it. And then we have, of course, the death by suicide, which is now the proper term. And then non-suicidal self-injury, which is known as the cutting. And these are usually in legs and arms. And people do this not with the intent of actually dying by suicide. So data, a lot of data out there, especially now with COVID. But there was a report by the Wellbeing Trust, and it talked about 75,000 additional people could die from what they call deaths of despair. And this is including death by suicide and substance abuse due to COVID. So there's one suicide for every estimated 25 attempts. There's one suicide for every 4 suicide attempts in the elderly. But also statistics show that there is a big percentage of people that died by suicide that did not have a mental health condition. So the purpose of talking about this today is so people can understand that sometimes they're signs and sometimes they're not signs. People that you didn't know had those thoughts or didn't know that they were battling with those feelings and emotions can have these thoughts and of course more than likely have a plan as well.
I know it's somber, and we talked about some of the stats, and you just can't deny them. But you did mention risk factors, and so how can we reduce these stats by recognizing these risk factors?
Right. So again, there's a lot of risk factors. So some of them can be perhaps previously suicide attempts, history of substance abuse, that's big, relationship problems, access to harmful means. So if they have access to a gun or any type of weapon, a recent death in the family or close friends, again, history of mental health condition, but not all of them have that. Exposure to cyberbullying or just bullying in general, physical and or disability or illness, or even losing a family member due to death by suicide. And another risk factor, which I'll go over later, that is very much related to COVID is financial. That is probably one of the biggest risk factors is somebody going through a hard time financially. That's been common in people that die by suicide.
Have we seen an increase in during COVID related to maybe that topic especially?
Yes, we have. So
Hmm.
let's talk about Osceola County. It's the county that has the highest unemployment rate right now. It's as of July, it was 37%. It did go a little bit down after theme parks opened, but that is a huge mental health burden. And they talk about how 16% of suicides are related to financial problems.
Hmm.
Hmm.
Wow.
Yeah.
Let
And
me.
mhm.
Sorry. Go ahead, please.
No. I was just going to start talking about the risk factors during COVID, but
Well, I'll just
go
do
ahead.
some housekeeping real quick. We do have a ticker underneath us that is highlighting a phone number that they can call. So if you're watching or you need to refer someone, we want to make sure that that information is readily available. So that's the number you see scrolling below us throughout this entire conversation. And this is Facebook Live. So if you do have a comment or a question, please feel free to leave a comment. We're monitoring that through this discussion as well. So back to the risk factors, Claudia, if you can.
Absolutely. So, of course, one of the ones that are most prominent right now is social distancing and isolation. And it's proven that isolation and loneliness is bad for our health, both mentally and physically. And right now, as of May 8th, there's still 200 million people in the United States that are still in some kind of stay-at-home order. And these are in areas that perhaps there's no longer a stay-at-home order, but they still want to isolate themselves. And let's add to that the already 35.7 million Americans that are already living alone. So definitely a big risk factor is social distancing and isolation, and of course the economic stress, which I mentioned earlier, and this could lead to depression, of course, suicide contemplation or attempt, substance abuse, neurotic disorders, psychotic disorders. And just to make a note that back in 1929, when the stock market crashed, um, there was a rise of suicide attempts that year as well. So
Mhm.
again, economic stress is a big risk factor when it comes to that.
Mhm.
We also have barriers to mental health care. Prior to COVID, 1 out of 8 ER patients were mental health patients. But now, with the whole stigma of COVID and people are staying away from the hospitals, so that is worrisome. However, clinicians and therapists and various resources are now moving to online platforms, making mental health care more accessible to people that are needing this service. So that's definitely good news that we're shifting, that we are accommodating and making sure that everybody can get the resources that they need. And then we have the collective anxiety, collective grief, collective anxiety. I'm sure you've heard that term because in the first time of history, this is something that we are all being affected in some shape or form. So there is the constant worry of health for us, for our loved ones. There's a change in sleeping pattern. There's difficulty sleeping and concentrating. I hear now there's a term called the pandemic fog, where we kind of feel like we didn't remember things that we used to remember before, or a little bit of confusion. So all that's normal as well. And then, of course, worry about chronic health problems related to COVID.
Mhm.
Um, and then, of course, there's an increase in alcohol and substance abuse during this time.
Can you?
And
I'm
mhm.
sorry. Go ahead,
No,
please.
go ahead.
Well, so we talk about the signs, and I. So your next slide goes to recognizing the signs, and we red flags, if you will, to kind of say, I'm fine, but I'm starting to see this in my colleague or my family member. So, just wanted to talk about seeing it in others, perhaps, and how we might be able to help them.
Right. So, of course, feelings of depression. So, feelings of depression include hopelessness, tearfulness, helplessness, isolation, um, lack of sleep, um, lack of interest in activities. So there's this lack of motivation, even energy. There's this irritability, anger, anxiety, shame or humiliation, or mood swings. Now, remember, now everybody will show this, but these are the rule of thumb of what are some of those signs. And one thing to keep in mind is if you do suspect that somebody is going through these challenges, the best thing to do is just go straight out and ask them, hey, have you ever had thoughts of killing yourself? Have you ever had thoughts of hurting yourself so bad that you wanted to die? There is this taboo of, well, if I ask that and they weren't thinking that I'm kind of planting a seed. No, it's very important to be direct and straightforward. You can save a lot of lives if you can.
If they say yes, can you coach folks now to next step after that?
Absolutely. There are a lot of resources out there. There's a suicide hotline that I will be sharing at the end with a resource page. We have a 24/7 intake department at Osceola Regional where we have licensed clinicians trained to handle these phone calls and provide the resources that people need during this difficult time.
So it's best to refer them to professionals once they affirm
Yes.
their thoughts. Okay.
Yes. Absolutely.
And then we're talking risk factors during COVID. I know you kind of mentioned that, but that's a slide on the screen. Is there
Mhm.
something special, because of the pandemic?
Right. I think right now, regarding frontline workers, doctors, nurses, EMS, um, they're worried about their own health. They're worried about exposing them the illness to family members, and there's this constant thought of them not doing enough for their patients. So, very important to keep our frontline workers in mind during this difficult time as well.
I'm sure you would agree, but everybody watching knows that they're loved and that they have a purpose in this life, and so sometimes we just need that shoulder to bring us back to reality and recognize that.
Absolutely. Yes, and there are a lot of resources out there, and
Hmm.
it's okay to not be okay. That is
Hmm.
the motto this year regarding mental health. It's okay to not be okay, and you're not alone.
Hmm. Absolutely.
Mhm.
In the next slide, I know we're getting to some. So, Christine, if you could forward to the next slide, please. Thank you. So, there's another graph. You want to talk through this for us?
Right. So, of course, the warning signs I mentioned, the emotional, but then we have the verbal of people actually saying it or expressing it, or if you notice that somebody is just very negative and constantly talking about death and dying, or maybe somebody already working on a living will or purchasing a gun, just signs. That they're not okay. And then, of course, the
Hmm.
mood, like I talked about earlier, just the depression, the constant depression, not them finding it difficult getting out of bed in the mornings. That's a big sign of depressive symptoms. And then, of course, their behavior, sleeping too much or too little, eating too much or too little, acting recklessly, impulsive behavior. They're talking about an increase in gun sales now in the United States as well, and they relate these to suicide by death. So in states that they see an increase in gun sales, they also see an increase in death by suicide.
So, Claudia, we all have bad days. That's the other
Mhm.
side of this, and I'm sure you're hypersensitive as a professional in this to attack it head on. But
Right.
at what point do you say this is maybe just a bad day, or so is there some they're sleeping in for several days? I mean, I was a college student, I slept in, right? So just trying to find a balance to
Right.
not overreact, perhaps, but also not underestimate the importance someone may need our intervention.
Absolutely. So the rule of thumb is if it's interfering with your family life, with your work life, then that's something to be worried about. So if you're sleeping so much that you're constantly calling out of work or being late for work, or losing your job because of that, then that's definitely a warning sign. If you're just making like big impulsive decisions that affects again your life and your family life. It's all about how it affects your everyday life.
Okay. Mhm.
So that would be the rule of thumb. Like you said, you slept a lot, but you were able to function and go to
Mhm.
work and take care of your family, take care of yourself. But when you can't, then that's when it becomes worrisome.
Very good. I know, 15 minutes goes quick. We're right here at the 15-minute mark. And so you want to talk through some of the slides here to make sure we don't miss anything. And you even had some examples I know you wanted to kind of share.
Sure. So just briefly wanted to talk about there's some social conflict regarding sheltering altogether. So these are just non-traditional warning signs. There's an increased PTSD, trauma responses, anxiety, fear, or paranoia. These are some things that are coming out now with COVID. There's been a disruption in our routines and support systems. So of course, reacting to that. The continuous stigma. And I wanted just to briefly talk about people that have died by suicide. I know we've seen a lot of famous people. Robin Williams, he was 63 years old. And though his wife did say that he did not have depression, he did have Lewy body disease, which is a form of dementia. Then we have Kate Spade. She was 55. She was battling depression for over 5 years. Her husband was in complete shock because that day she was happy. She hung herself. And then we have Chester Bennington from the band Linkin Park. He was 41 years old. He did have a history of depression, a history of suicide attempts. But his wife also said that they were on a family vacation and he went back home to film a commercial. And that's when he decided to die by suicide. We have the physician, Dr. Lorna Breen from New York, that was so overwhelmed with COVID and the pandemic that she also decided to end her life by death by suicide. We have Jason Flatt. He was a 16-year-old boy. His father started a wonderful foundation, which we are sponsors of, Jason Foundation. He was 16, football player, Christian family. That day he had fun with friends. He hung out. And he died by suicide. Parents in complete shock because he was always so happy and he was that one kid that was going to succeed after graduating high school. And then lastly, we have Jared Wilson, 30-year-old pastor in California. He was also a huge mental health advocate and he also died by suicide. So again, some of them show this signs, some of them don't. But if you ever doubt, if you ever have that gut feeling of a loved one, just straight out ask that question and know that there's so many resources and so many services out there for them.
So real quick, as you get to resources and I just, you talk about Jason not showing any signs and we've been identifying signs. Is it probably good just to do an occasional check-in? And I know there's some resources around the county that actually have that, but
Yes.
If they're not showing signs, they're just keeping it inside. What do you recommend there?
Well, perhaps they weren't showing the known signs, but I'm sure there was something, maybe a conversation that he had with a friend, maybe a comment. So the rule of thumb is if you're worried, if you have just like a sense or it's always good to just ask or maybe refer, educate them on resources or talk about, hey, it's okay to see a therapist. There's so many services out there. It doesn't hurt. There's hotlines that you can call and just talk to somebody. So even though there may not be like visible signs, there should have been something there.
Sure. So we're on the resources page. If you could talk through this, and I really hope you'll, for our audience of business owners and business folks, talk about your in-services that you can share and come on site, whatnot, too, please.
Absolutely. So I provide in-services to all types of employers just to talk about various topics on mental health. I think now more than ever, it is very important to just be aware and know of the resources and just a lot of psychoeducation on what are those feelings and emotions that we are all going through during this time. This is offered free to the community, and this is just a way to provide support as Osceola Regional Medical Center behavior program, just to provide that support to our community. So A great resource is NAMI of Greater Orlando, National Alliance of Mental Illness, and they do have a local chapter. They have support groups and classes. Of course, we have the American Foundation for Suicide Prevention. There's a phone number, or there's even a way to text to get resources. There's also a local chapter, Heart of Florida United Way. Dial 211. It's a crisis line. It can connect you to all types of resources. We have the alcohol and drug helpline. You can also text them as well. If you are employed, usually employers offer something called Employee Assistance Program. It is free counseling sessions. Could be 1-2 sessions, but it is a good resource to take advantage of. And then, of course, if you have health insurance, you should have a behavioral health plan. So inquire about that. Psychologytoday.com is a great search engine for therapy and other mental health resources. And then lastly, of course, our behavioral health programs at Osceola Regional, where we offer inpatient. We have a crisis stabilization unit, and we have a Baker Act receiving facility. We also offer outpatient services, which includes a partial hospitalization program, intensive outpatient program. And those are for people that perhaps are in counseling, but they need something more, yet not enough to be hospitalized. So this is just a little bit more of a treatment. It could be all day or half a day, just based on the needs of our patient. It could be 2 to 4 weeks. And then, of course, we recently opened a continuity clinic where we're offering outpatient psychiatric services. Those are for people that would like to start medication to address those symptoms. And then we also offer something called ECT, electroconvulsive therapy, and that is done both inpatient and outpatient at the hospital.
And I know the other organization in town is Park Place Behavioral. We were trying to get them to participate in this discussion as well, but they're an important resource as well. And so, and then there's some other programs that are out there. So we've included as much of this as we can in our text thread. Hopefully, we've left nothing unsaid. We are champions for business and community, and this does affect both business and community. So a wonderful topic, a wonderful guest, knowledgeable, and we always appreciate you, Claudia. Well, I'm sure we'll have you back on another this episode at some point. But we appreciate all our viewers for tuning in. We'll be back next week as always. Thanks again to Claudia, and we'll see you next week.
Thank you, John.
Mm-hmm.